welcome to Hashimoto's Unfiltered, real talk, real solutions. The podcast where we cut through the noise and get straight to the heart of living with Hashimoto's. My name is Dr. Ray Benedetto, your host, and I'm here to share my expertise, personal insights, and from time to time, conversations with incredible guests to help you take control of your health. Together, we'll explore actionable items, debunk myths, and navigate the complexities of your thyroid health. So whether you're newly diagnosed or a seasoned warrior, this is your space for unfiltered truth and real hope. Let's dive in. Today's topic, low-dose naltrexone. Let's take it from the top. What is low-dose naltrexone? So some of you who are watching this have heard of it before or asking about it. Some of you who are watching this are going, what the hell is he talking about? Let's kind of go do a full circle look here, all right? So low-dose naltrexone, or otherwise known as LDN, okay? It's a medication that is prescribed. It's called low dose because naltrexone, the original, and it's been around for a long time. Like it's been around, I think, since the 60s, to be honest with you. Naltrexone is a drug, a medication that is typically given for addiction, opioid addiction primarily. So it's given for addiction to opioids, classically, typically 4.5 milligrams, something like that. Low dose 50 to 100 milligrams. Low dose is usually around 4 or 5. So low dose naltrexone is a very low dose of naltrexone. Okay, usually up to about 1/10 of the regular dose. So if it's 50 milligrams for regular naltrexone, they give to somebody for opioid addiction, then low dose naltrexone is 5 milligrams, right? So it's a very low dose. What is it used for? Okay, it's used for autoimmune thyroid disorders. That's why we're talking about it, right? It's prescribed for it. Let's say this: chronic fatigue syndrome, chronic pain, fibromyalgia, you name it, right? Lots of different chronic pain syndromes and chronic illnesses. Now, prescribing or using low-dose naltrexone for any of these conditions is off-label. It has not been approved by the FDA to treat those conditions. Low-dose naltrexone has only been ever prescribed or approved to treat for opioid addiction and withdrawal from opioids. It is prescribed, and we'll get to why. It is prescribed for these other conditions off-label, which means it has not been approved by the FDA for the use of treatment of those conditions. There actually have not really been any substantial trials, drug trials, looking at low-dose naltrexone and the benefits for any of these other conditions. But what would happen is the doctors would prescribe naltrexone for opioid addiction. And then when you're trying to get people off of naltrexone, you would taper down, right? So you would go from this dose to this dose to this dose, like you taper over time. And what they found was that a lot of people who were doing that reported improvements in pain levels, fatigue symptoms at these lower doses than they did at the higher doses. There have been a few small trials that have shown some benefit, like with conditions like fibromyalgia or chronic pain syndromes. But that's it. There's really not a whole lot of evidence or studies of any kind that naltrexone is beneficial for those patients with those conditions. It's been purely anecdotal, right? So like doctors just saw this and that they saw this happen and that's what they prescribe. So how does it work? So the low dose naltrexone works really in the opposite way of high dose naltrexone. It's called a paradoxical effect. So at low dosages, the naltrexone appears to trick the brain into producing more of its own natural opioids, right? So what it does is at low doses, it helps the brain to produce more natural painkillers. So obviously that increases the natural levels of opioids that our body makes, right? Which makes us feel good, gives us pain relief, that kind of thing. The low dose naltrexone has a very short half-life. That means it only lasts around 4 to 6 hours. But again, it's enough to boost the levels of the naturally occurring opioids for sometimes up to 24 hours. And again, there's some anti-inflammatory properties, all that kind of stuff. So, at this point, it's prescribed to help with symptoms. pain, fatigue, stress, inflammation, that kind of stuff by helping to increase the production of our own natural painkillers, our own natural opioids. That's low dose naltrexone. That's how it works. That's the mechanism behind it. That's what it's for. Okay. And that's why it's used. It is for symptomatic relief. I'm not saying that's not important. That's very important, which is why people ask me all the time, what do you think about it? And I'm like, I give them the story I just told you. Look, it's been around forever. We kind of stumbled on it by accident that it can help people with pain and fatigue and stuff like that. It's off-label, so it's not approved for treatment of Hashimoto's, let's say. But a lot of doctors prescribe it to help treat the symptoms of those things, right? Of chronic medical conditions. Let's talk about Hashimoto's particularly. So I don't really have a problem with people trying it. There's no way of knowing if it's going to work or not unless you try it. And I've had patients who tried it and they're like, it helped tremendously. I've had other people who tried it and they'll be like, I didn't notice a thing. The risk, kind of outweigh, or the benefit kind of outweighs the risk, I should say, because the side effects, there's not a lot of side effects from it, to be honest with you. There are some side effects, but the side effect profile, as we call it, is not terrible. Like some other medications like statins and cholesterol drugs and stuff, which can be nasty. So a lot of times it's at least worth a shot. Now, you guys have been around here long enough, know me, and two things, right? So yes, I want patients feeling better. Like they get to me and they're like, I feel like garbage. I have all this stuff going on. I need to get better. Of course, we want relief from symptoms. I get it. We want the fatigue gone. We want the weight to come off. We want the digestive system to work again. We want the brain to work again. Like we want the hair to stop falling out. We want all these nasty symptoms that you get with Hashimoto's to stop. I get it. That's why people come to me. It's not because I have Hashimoto's and I'm hunky dory and I don't, I need you to fix it. I get some of those, but a few of those. Most of the time it's because like I got all these rotten symptoms. I feel like garbage. My health is in the toilet. It's only getting worse. I know it's due to the Hashimoto's. All right, well, we got to fix the Hashimoto's to get the symptoms to go away. I'm all for the low dose naltrexone. I have no problems with my patients taking it or trying it at least to help with symptoms. That's all it's going to do. It might help with the pain, might help with the inflammation. It can help with some of the symptoms because of what I just laid out for you, because it helps to stimulate the brain, the body, release its own natural painkillers and anti-inflammatories. That's great, but it's not fixing the problem, right? It's not fixing the underlying autoimmune problem, the Hashimoto's, that's causing all of that in the first place. So yes, it can help give relief from symptoms, and I'm all for that. In the short term. In the long term, it doesn't fix anything. Actually, in the long term, if we're covering up symptoms, the underlying autoimmune damage can be continuing. That's the challenge with any symptom treatment. Like, you have a herniated disc in your back, you get an epidural injection. Okay, great. It makes it feel better. I don't feel the pain for a little while if it works at all. But the herniated disc is still there. It's still pressed on a nerve. Like it's still there. So when the shot wears off, it's back. It's right back to where it was. And the damage is continuing. I just couldn't feel it because it was all numbed up. So the low dose naltrexone is not a treatment for autoimmune thyroid or Hashimoto's. It's a treatment that can help relieve some of the symptoms that come from it, which again, I'm okay with. And it's got, like I said, the side effects aren't terrible on it. So it's okay in the short term. But that's why it works. And that's why it's prescribed for certain chronic pain syndromes, Hashimoto's, fibromyalgia, chronic fatigue, that kind of stuff, is because it does help. It helps our body to release its own natural painkillers and natural anti-inflammatories. So it's okay to do that. But while we're doing that, we need to get to the root cause of the autoimmune thyroid condition and get a plan in place to treat that, because in the long term, that's what's going to get someone into remission and get them better in the short term and in the long term, right? So we're taking all this low dose naltrexone and it's making me feel better, but it's not stopping the underlying autoimmune problem and the autoimmune attacks. So we need something in place, a plan, a treatment plan in place underneath of that. So if that stops working or we got to come off of it and the bottom falls out, like where's the safety net? People ask me this all the time. It's like, okay, I'm doing this, but I want to stop doing this. I'm like, okay, well, you have Hashimoto's, which is causing this. So we need to get a treatment plan in place underneath that that's going to figure out the root causes on the Hashimoto's and treat that. So that way, when we remove this, we're good, right? We have this safety net. I hope that makes sense. That's the deal with low-dose naltrexone. I have zero problems with it. Take it. It can help symptomatically. It's just like everything else in medicine, like pills, it just doesn't fix the problem. It may make you feel better. That's great. I love it. It's just not long-term going to fix the problem. It's not going to stop the Hashimoto's. I hope that makes sense for everybody and kind of sets the record straight for the low-dose naltrexone. And docs prescribe it. I get it. I have no problems with people taking it or trying it. You guys ask, I'm like, this is the spiel I give. It's not a treatment for Hashimoto specifically. It's prescribed because of what we just went through. Doctors have seen that it helps symptomatically some people feel better because you're releasing opioids, which make people feel better. The key here, however, is whether we're doing the low-dose naltrexone or not, which you guys have heard me talk about umpteen times, is to get the Hashimoto's fixed and to get someone better short-term, long-term. Have to do the work. We have to figure out what their root causes are, put a plan in place that's going to treat those things, run them through an AIP protocol, get the immune system, figure out what's causing it to attack the person, right? That's really what's going on here. Get it to stop, get them to heal. Okay, that's what's going to get people better in the short term and the long term. Low dose naltrexone, take it, don't take it, doesn't matter. Still have to fix the problem. If it helps symptomatically, awesome. Let's get some relief while we're fixing stuff. But then again, it's not the long-term strategy too, right? The goal is, okay, if we got taking it or not taking it, doesn't really matter. Take it, great, it helps. Relief, good, I feel better. Cool. Let's do the work now to fix the Hashimoto's, and then we get that in place, and then we can take the LDN away, and now we're better and we're healthy, and we don't need medications to make us feel better. Hope that makes sense, Ken. I want to thank you for tuning in to Hashimoto's Unfiltered, Real Talk, Real Solutions. Again, my name is Dr. Ray Benedetto, and I hope today's episode helped to give you the tools and the insights you need to take another step forward on your Hashimoto's journey. Don't forget to subscribe, leave a review, and share this episode if you think someone could benefit. You can also connect with me on Facebook at Dr. Ray Benedetto and on my website, drraybenedetto.com, for more resources and updates. Until next time, remember, you're not alone and real solutions are always within reach. Take care and be well.